I saw an article this weekend entitled, I'm going to read it here, "A WNBA veteran becomes the latest player to suffer an ACL tear." And the lady's name is Katie Lou Samuelson. She plays for the Seattle Storm, and she's actually the third Seattle Storm player to have torn her ACL before the WNBA season this year starts. And I thought it was really good to record this video because just the incidence of ACL tears amongst the female population is just so high. To the American Journal of Sports Medicine, females are 4 to 8 times more likely to suffer an ACL tear than their male counterparts in the same sport. And 70% of these injuries are non-contact in nature. So they weren't hit, they weren't slide tackled. It almost seems like a freak accident in many ways. And the reasons for this are varied, right? One of the most predominant beliefs are that females have what are called a wider Q angle, which essentially means that they have wider hips. And so their legs or femurs, the thigh bones, make an angle that sort of angles inward, almost more like a V, relative to males who have a narrower pelvis, and therefore their femurs, their legs go a little more straighter up and down. That wider Q angle, or those legs that sort of angle inward a little bit that females tend to have more than males, can result in a variety of different things, such as a tendency for the femur to internally rotate and adduct, essentially dive inward. And when combined in a very high velocity movement, especially if maybe they don't have very strong hamstrings relative to the quads, the muscles in the front of the thigh, which is called a quadricep to hamstring strength ratio, that can increase the risk of having that ACL tear. So when it comes to programs that are meant to reduce the risk of suffering an ACL injury, we want to start off by strengthening the muscles that are going to slow down how quickly that femur, that thigh bone, is going to dive into internal rotation and adduction, essentially the inward twist when your knees come together. We want to strengthen the muscles that slow that down, that control that. Those are the muscles that are located throughout the hips, such as the glutes. In addition, we want to strengthen all the other muscles around the knees, maybe to address that quad to hamstring muscle strength ratio that I referenced earlier, to get to the point where we know those muscles are capable of generating the force necessary to be able to protect themselves. But just being strong isn't enough. We need to make sure, in addition to being able to generate sufficient force to protect the knee, they also can generate that force quickly, like it will have to when we play a sport. So if you're a soccer player, or a basketball player, you're going to be cutting and jumping and doing all these things very fast and rapidly. We need to make sure those muscles are able to contract and protect your body accordingly, just like it will have to when you play your sport. So we are going to incorporate the strength that we have developed maybe in the weight room onto our turf area in drills that involve jumping, hopping, so that we can address any landing mechanics, your ability to land properly and then generate force quickly, because oftentimes an athlete will look great when things are done slow and controlled, but all of a sudden when we add the velocity component, then we start to see some compensations start to come out. And if somebody is showing these compensations in a controlled setting, such as in our training area, we are pretty sure they're going to be showing those when they're on the field as well. So it gives a lot of opportunity of things we can address. Now, of course, we're going to take everything we do here and get some data behind it. We're going to want to get our athletes on the force plates to get some data behind what they may actually look like in the other pieces of sports technology that we have in our office. So if you are the parent of a female athlete, or you are an athlete yourself and you're worried about potentially having an ACL injury and you want to do everything you can to reduce the year-long hiatus from sports that's going to happen after that injury occurs, contact us. We would love to be able to help.